Well, it seems there's women power on New Day here this morning. Earlier, we spoke to philanthropist Nanette Medvedpo, who received an award, and now there's another awardee, this time in the field of medicine. Dr. Beverly Ho of the Department of Health is one of this year's 11 recipients of the Towns Award, or the Outstanding Women in the Nation Service Award. And Dr. Ho now joins us live via Zoom to tell us more about this. Doctor, good morning. Thank you for joining us. And first of all, congratulations.
Thank you, Ria. It's great to be here.
Now, Doctor, being a Towns awardee means that you've accomplished something really significant, which enriches the lives of the Filipino people. How does it feel, and what does this award mean for you?
Of course, I feel very privileged to be part of a group of servant leaders for many years, many of whom have been my mentors in the UP College of Medicine. But I think more importantly, this award is really for the community of public health workers who are usually not at the forefront of the medical field, no? Because we really don't see patients on a day-to-day basis. I'd like to think that this is something to recognize the field, but at the same time also to encourage many young professionals to get into public health really as a legitimate field apart from frontline clinical services in the medical field.
Right, but you holding your position at the DOH has put you at the forefront of the fight against COVID-19 pretty much since the pandemic began about 2.5 years ago. So talk to us a bit about, when you look back, what were the biggest challenges that you experienced when we were facing this disease that we knew very little about and that affected the whole world?
Exactly how you said it. I think humility was a very big part of this process because typically a health authority would know a lot more about the general public about a certain public health threat. But for this particular pandemic, we had to roll with the punches, essentially. With new evidence coming in, we had to perhaps change our statements or our policies along the way and still need to gain the trust of the public. And of course, unlike, say, certain disasters that probably are more localized, this one affected everyone. It included even our teams, right? But we had to make sure everyone had to still come into work because we had the public to serve. So, apart from the typical COVID-19 impact to the general public, we also had our teams, internal teams to take care of. They have their own, we have our own challenges, mental health, for example, even within the DOH staff. So we had to balance those while still making sure that we deliver to the public.
Right. Now, Doctor, it seems you're somebody who likes to work more behind the scenes. The public doesn't know you as well as maybe other DOH officials. And you've said time and time again that your mom inspired you to become a doctor. Tell us a little bit about that and how you found your way to public service.
Yes, so my mom is an obstetrician gynecologist, and within the Filipino-Chinese community, she'd had lots of patients, including like my teachers from grade school, my classmates, for example. So I think that was really the model that I saw growing up, and saw that she really enjoyed seeing patients, going home late, etc. But it was really in UP College of Medicine that our mentors really showed us another aspect of medicine. Yes, we can help patients one at a time when we see them in our clinics, but there's actually a bigger systemic challenge wherein, even if we try as best to give them the best clinical care, if they don't have the resources, not just money, but the physical environment which they're in, are compromised, then we only really just in a way bring them back to the conditions that made them sick. So I guess this dynamic is really what allowed me to still continue to train as a medical doctor, but also to look at another option to serve the country in a not so usual way.
That's right. Now, looking forward, Dr. Ho, the country is gradually taking steps to live with the virus. We know that we're not really going to get rid of it, but we have to learn how to live with it. How would you describe the status of our healthcare system now? How has it changed or improved compared to 2 years ago?
I think the pandemic has really exposed the cracks that have been long-standing in the healthcare system. Now that we have more resources coming in, more people are aware of what the challenges are, particularly, of course, our legislators know who now become the biggest champions of, say, budget increases for the Department of Health. I would say that the foremost challenge would be institutional capacity. Right now that we have more resources, we need more people who can help plan, design, and even dream about a better system to put in place. After all, if we have so much money but we couldn't plan it appropriately, then parang it would be a wasted opportunity. So I'd say that apart from the typical, okay, we lack human resources, doctors, nurses, midwives at the front line, we lack medicines, etc. An underlying issue that I am most passionate about is really building institutional capacity. And part of that is hoping that a lot more of our promising younger professionals really look into public health, public policy as really a sustainable path for them to not just, be better professionals in this country, but also be able to serve the Filipino people.
Well, Dr. Ho, the DOH is very lucky to have you. Indeed, the entire country is lucky to have you. Congratulations once again.
Thank you, Ria. Good morning.